we moved to Nome, bought a home, and maybe within 3 months later, I found out I was pregnant. I was considered a high-risk pregnancy from the beginning. About my third month into pregnancy, I started having some complications that led me to come into Anchorage a lot more frequently than most, because in Nome there is no high-risk providers. You're supposed to come into Anchorage to wait for delivery for at least 6 weeks prior to your first early delivery. I had to come into Anchorage a lot earlier. His delivery wasn't supposed to happen until June, and I was in Anchorage waiting for delivery in February. I was having a lot of complications, lots of complications before he was born. And once he came, things were much better. He was doing really well, about till 36 hours of life. And he had a pulmonary hemorrhage. Then we got notified that he had a bilateral third-degree brain bleed. It's a complication that some preemies have. And shortly after that, we noticed, his head circumference growing in size, and I wanted to stay up on it. I didn't want to play the wait-and-see game. Kept asking the doctors, what's going on, and the NICU doctors, they were great in the process when I said I had enough, I wanted to seek a referral. I remember the doctor came in, he goes, "I know the perfect guy." So I really thought that it was going to be, how most referrals go. It was going to be, weeks. It was really just a few hours. It was on a Sunday, and we met Dr. Rosenbaum that Sunday night, and he was very blunt. It's what we needed. But he had a plan. He said, "Nope, we're not waiting any longer. We're going to do a reservoir, and if the reservoir works, then we will not need a shunt, and we won't need any further treatment for the hydrocephalus." Hydrocephalus is well known as fluid on the brain. We scheduled the surgery within 3 days of meeting Dr. Rosenbaum. Things went great. The shunt was placed. Got discharged from the NICU after 93 days. He had a lot of complications. He did come home on a feeding tube. Dr. Rosenbaum not only treated me like a mom and also a nurse, but he also respected me and my decisions with Luke. So it was an accumulation of all the times that we've been here that I felt heard. Dr. Rosenbaum would spend literally hours sitting in the, with us in the hospital room, just trying to figure out what was going on with Luke. Since he wasn't textbook, this wasn't something that you hear about or you read about with his complications that he had. So we were lucky Dr. Rosenbaum listened, and he didn't just pass things over. I wanted direct answers, and he provided every answer, every situation, very, very matter-of-factly, and that was exactly what we needed. When you're dealing with a brain injury, you have a window of time before you start having brain damage. The mom instinct just kind of kicked in, and nope, this is exactly what we're going to do, what we have to do, and there's no questions. If it wasn't for Dr. Rosenbaum, I don't think the prognosis for Luke would be so well. He gave me my son. If we would have had a different provider, we may have done the wait-and-see game, and the wait-and-see game may have not had the same outlook as what we have now. Rosenbaum cut Luke's hair first. Actually, every haircut he's had, Dr. Rosenbaum has cut. So each time that he's had a shunt, he's had to take the other shunt out. So total, he has performed 7 brain surgeries on him. He means a lot to us. I just started crying because Dr. Rosenbaum gave me my baby back. Luke is just amazing. He is on target with all of his stuff, and within a week of us being home after that brain surgery, he started to sit up on his own. He started to roll over. There is nothing that baby can't do. He's walking, he's running, he is talking. He is playing with our dogs. He loves to play ball. When doctors say he probably wouldn't be doing this or he can't do this, he's saying can't what? Yep, Luca's running around. He's just a rambunctious 18-month-old, just full of sunshine, just bright-eyed and bushy-tailed, so happy.